The difference between what President Obama promised his health care overhaul would cost and the latest projections is making some Republican lawmakers sick. Chief National Correspondent Jim Engel looks at the numbers and what they mean to you.
The Congressional Budget Office has extended its cost estimates for the president's health care bill out to 2022, taking in more years of full implementation, and that shows the bill is substantially more expensive.
The bill spends more than the president promised. It covers fewer people, probably $2 million fewer people, and it taxes more than was expected.
CBO projects the bill will cost $1.75 trillion between now and 2022, but that only includes the cost of coverage, not implementation and other costs, which Senator Sessions argues will drive up the price even further over the first full 10 years of the law.
The full accounting of the bill is $2.6 trillion. That's a fair and accurate analysis of what the bill will cost, according to CBO, and the president sold it to the American people as a $900 billion bill.
Part of the increased cost estimates are because CBO projects out 10 years, so its early projections included years in which no money was spent.
The spending doesn't begin until 2014, and so you got to count a couple of years where nothing was going on. Now, those years are steadily going into the rearview mirror, and what we're seeing instead are years where it's fully implemented.
One Democrat says the hope is that competition will lower costs.
There's no big new government health plan being offered. It's all private sector options, and we hope they will compete against each other to get the prices down.
As expensive as it is, the CBO predicts the bill will actually reduce the deficit. The reason? A range of tax increases and penalties on individuals, employers, and insurance companies, which offset the cost.
CBO projected a lot more tax revenue coming in, so it looks like a deficit reducer, even though we're spending tons of money.
The CBO predicts 4 million people will lose employer health care coverage and that there will be 2 million more uninsured than the administration first projected. Some worry that more people will go on the exchanges and get taxpayer subsidies, which would push costs up even more. But Congressman Cooper says preventive care could help.
It's possible it won't save anything at all, but it's also possible by heading off diabetes and hypertension and problems like that we could save a lot of money.
So far, the costs keep going up, and the law doesn't even fully take effect until 2014. But even before that, just 12 days from now, the Supreme Court hears constitutional challenges to the law that could change everything. Bret?
More on this topic with the panel. Jim, thank you. Well, there are new projections out from the Congressional Budget Office, the CBO, about the cost of the president's health care law. They've extended out the time frame out to 2022, from now to 2022, 10 years. And the CBO, as opposed to March of 2010, when the estimates you heard the president say $938 billion, now the new estimate is $1.762 trillion, the cost of health care. Senator Sessions argues that it's even beyond that. If you extend it one more year, another year of implementation, he says the real cost is $2.6 trillion. Bottom line, it's more expensive than originally billed. Let's bring in our panel. Steve Hayes, senior writer for the Weekly Standard. Susan Milligan, contributing editor for U.S. News and World Report, and syndicated columnist Charles Krauthammer. Okay, Charles, surprised, I'm sure?
Well, when we talked about this in 2009 and 2010, we were saying that there was a fraud at the very center of these numbers. And that was that the Democrats understood that the CBO always projects 10 years. So they built an Obamacare where the first 4 years of that, there's nothing going out. It doesn't start until 2014. So you do a 10-year projection, but you really only have 6 years of spending. So it would look as if it would have low, decade-long numbers. As we approach the beginning of the program, and the years of no spending are fading away and are behind us, we're getting a real appreciation of the actual 10-year spending, which will kick in 2 years and extend until the end of time. And when you do that, you end up not with the number that Obama had promised, but a number that a lot of Republicans and conservatives had pointed out was going to be roughly what it is. And it's what Sessions is talking about today, $2.5 trillion. Think about that. It means on the average, every year, again until the end of time, we're going to add at least $250 billion in entitlement spending onto a deficit that America already was crushing us in the absence of Obamacare. And that's what we're learning today.
Susan, the other interesting thing about the CBO report was that the CBO now projects that 4 million people will lose their employer health care coverage. 4 million over the next 10 years. It also says there will be 2 million more uninsured that the administration projected, 2 million more than they projected at the beginning. You know, not a lot of people are covering this. Right. It's pretty deep into this bill that's 2,700 pages long and now law. How does this play?
Well, I'm not sure that the CBO report is going to mean anything to voters this year. I think people are pretty entrenched already as to how they feel about the health care law. Nobody's freaking out maybe as much as they might have, the people in the middle, because maybe the only thing that they felt so far is they can put their kids on until they're 26, or maybe their parents don't have a donut hole. They're not feeling the mandate yet. They're not feeling any of that yet, which is, of course, how it was designed, to have these things sort of front-loaded politically. So I'm not sure that that's going to have an impact when the Supreme Court decision comes out. I think that that's going to get people fired up again. But, you know, these 10-year things, whenever I cover the budget every year, you know, and it's just really long and boring and I want a good laugh, I turn to what the 10-year projections are for any of the spending, because it's just ridiculous. Nobody can, I mean, anything could happen, world events, all kinds of economic disruption that you can't possibly predict, not even the CBO. So I always take any of that with a grain of salt.
You know what it never is, though? Lower. They never err on the side of lower. It never costs less. I mean, it's always going to increase costs. I mean, I think there are a number of things at work here, and Charles' description of the 10-year, but the moving 10-year budget frame is correct. There are also weaker economic growth projections built into this, but the bottom line is it's likely to cost a lot more, but that shouldn't surprise anybody. I mean, you're talking about creating a new entitlement, insuring 30 million more people. It was never going to cost less. So the people who were suggesting initially that it was going to cost less, I think were just selling a bill of goods. It wasn't honest.
Charles, one of the things that Senator Sessions and others are pointing to is that the possibility that more people will be forced onto these exchanges and that there'll be more taxpayer subsidies to help more people out. There are already an estimated 18 million people will be put on Medicaid, more than are currently. Democrats like Congressman Cooper say preventative care and can help in driving costs down. You don't buy that?
Well, it's rubbish. It's been shown by really very specific and very accurate and scientific studies that preventative care, which always sounds wonderful in the abstract, increases cost. And the reason is, if you prevent a person from getting a disease like a stroke, of course you save a lot of money. But you never know who's going to get the stroke, so you do screening and you do all kinds of preventative care over huge populations. And that's where all the money is. You do thousands of mammograms, and you might get 1 or 2. Now, look, it'll save a life, and that's why all of us will do it. But the idea, but it costs. There isn't a free lunch even in prevention. The idea that because if you look at one person and prevent a disease, it lowers the cost it's going to do over a population is not true. So everybody always looks for a panacea or a free lunch. It doesn't exist in medicine. In fact, it's the opposite. The most rigorous studies have shown that wide-scale prevention and screening adds dramatically onto healthcare costs.